Do you or your child struggle with different sensations? Now, you might or might not have heard of this disorder called sensory processing disorder that might explain why your child or yourself are experiencing these sensations. Things like textures, sounds, lights, these can all be quite irritating and cause you to go into states of overwhelm and dysregulation. We're going to talk about why this is and some tips on what you can do about it. Sensory processing disorder is a condition where the brain has difficulty receiving, processing, and interpreting sensory information from our environment. So this can affect multiple different sensory systems, including our smell, our taste, our hearing, our sight, our touch, and also three other ones: our proprioception, which is found in our joints and our muscles. And this allows us to know how much pressure we need, let's say, to push a box or to pick up our cup. And also there's the vestibular system, which is in our inner ear. It tells us where we are in space, if we're tilted to the side or we're leaning forward. And the third one is our interoceptive system, which is in our internal organs. It tells us things like we're feeling thirsty, we're feeling hungry, or we need to go to the bathroom. So sensory processing disorder, or I'm going to start to refer it to SPD for short, is when we over-respond or under-respond to sensory information in our environment. We can also have a mix of the two. So you might be over-responsive in one sensory system, such as maybe touch. You don't like certain touch and certain textures, and so you are over-responsive to that. It feels very uncomfortable and overstimulating when you touch these things. Or you might be under-responsive to proprioception. So you might feel like you're not noticing certain things in your environment and you're often acting quite clumsy, or your child's acting quite clumsy. This can show a sign that you're not receiving certain input from your proprioceptive system to tell you where things are, and that's why you're bumping into stuff. Now, SPD can really impact an individual's day-to-day functioning. It can impact your day-to-day life at home, getting through the morning routine. You might be finding that it's really difficult to get your child to brush their teeth in the morning because they're really sensitive. They might be telling you, I don't like it hurts, or ew, I don't like the taste of that toothpaste. And because of SPD, they're interpreting that information from those objects, from the toothpaste, from the toothbrush, and it's feeling so much more intense, right? For a neurotypical individual, someone who doesn't have these sensitivities, brushing your teeth doesn't really feel like anything that's uncomfortable. It's just something that, when you put that toothbrush in your mouth, you can feel it there, but it doesn't hurt you. But for a child or an individual who does have SPD, it can really feel painful. It can feel super uncomfortable, causing them to try to avoid that activity or that task, or really just push back. Because imagine when you're uncomfortable or in pain, who wants to push through that and allow someone to try to brush their teeth? You're going to start pushing back. So that might be why you're noticing your child is engaging in these very aggressive behaviors with you over something that seems so small. So something to note, SPD is not something that's recognized as a standalone diagnosis in the DSM. And it's often associated with other diagnoses like autism or ADHD sometimes. And so just something to note, but at the same time, I've also worked with individuals who had SPD and they didn't have a diagnosis of autism or ADHD. So it doesn't mean that if your child seems sensitive and has SPD, that they automatically have autism or ADHD. That is something that you need to make sure you're speaking with your child's developmental pediatrician or psychologist who can formally assess for that. So in this video, I'm going to focus on a specific subset within SPD, and this is sensory modulation disorder. There are three different kinds that I'm going to get into. The first sensory modulation disorder are sensory seeking behaviors. So you might find your child is always seeking input from their environment. They might be moving all the time, touching everything, putting everything in their mouth. These is what we consider sensory seeking behaviors. And oftentimes it can be quite disruptive, especially in classroom settings where your child has a really hard time sitting still, sitting at the desk, and getting work done. At home, it can also pose some challenges as well, where your child will not sit down to do their homework or sit down during meal times. They might be touching everything when you go out in public, and they are kind of like when you go into a store and you feel like you're always there trying to block them from touching things because you're afraid everything is just going to fall off the shelves. It's because they are seeking for that tactile input from these novel items that they're seeing. Now, a note to remember is that toddlers are often sensory seekers, so we need to differentiate between the two. In the toddler years, they are still exploring their world. They're trying to figure out how things feel, cause and effect. If I touch something and then I drop it, it's going to smash. So these are very normal toddler behaviors. So I wouldn't be quick to assume that if your toddler is engaging in these types of behaviors that they have SPD. This is something that if you're noticing your child's in more of the primary age or middle school age and they're engaging in these types of behaviors, this is where speaking to a professional to identify if they may have SPD is something to really look into and to address. The second sensory modulation disorder is an over-responder. So this would be your child if they are over-responding to a lot of sensory input and feeling very resistant, avoidant. So you might find your child is really resistant to certain types of food textures because they are over-responding to that texture and it's feeling really overwhelming to them. That's causing them to reject it. They might also be an over-responder to tactile sensations. So things like tags on their clothes or the tightness of their clothes can make them feel very uncomfortable. They might be telling you that it's so itchy, it's scratchy, it's too tight, and they are wanting you to just cut off all those labels because they can't stand it. This is what we would consider an over-responder to tactile sensations. And finally, there's the under-responder. This is the child who just doesn't seem to notice things in their environment. It takes a lot for them to pay attention to it. So we would find them to be very clumsy because they're not noticing that that table was there and they just kind of like knock right into it. Or you might be calling your child across the room and there's no response. They don't even look to acknowledge you. They might not be able to process that auditory information. And in some cases, your child, and this is something that I do encourage parents to seek further assessments on, is if your child struggles with processing auditory information, check to speak to your child's pediatrician if they have auditory processing challenges, because this can impact them, especially at school. I find a lot of kids who struggle with auditory processing where they're under-responsive or they're just having a really hard time, weeding out all the different information like auditory noises. And so they're just completely missing out on information. Then this is something that will impact them at school. They're going to not be able to catch on to the information that's being taught. So there are so many implications when we don't address SPD head on. Because as you can see, if you have a sensory seeker, you have an under or over responder, there are going to be impacts on your child's day-to-day life. Having differences in sensory processing can impact how you're perceiving information, and this can impact them at school, how they're learning, and can also impact them in social situations when they're trying to make friends with other kids and they're missing information, or maybe they're very sensitive to certain things and it's causing them to have a hard time to participate with others because of that sensitivity. So we need to address it. If you're a parent who has a child with SPD, having conversations with their teacher, working with specialists who understand SPD is very important in collaborating and figuring out what it is your child needs to help them manage day-to-day things. Because what I've seen too often is that when kids don't get the right support when they have SPD, they struggle. Some of our kids, they mask, they pretend like the struggle isn't there, but internally they're struggling, and this starts to impact them from a mental health perspective. Other kids who don't mask and it's very clear that they're struggling, well, it starts to snowball into their academics. They start to have a really hard time learning. This puts them further behind. It makes them, from also a mental health perspective, when you see other kids thriving, being able to achieve, and you're not, it starts to make you feel like, well, there's something wrong with me. There's something fundamentally wrong with me. And this is stuff that we don't want our kids to ever feel, because there isn't something wrong with them. They're just processing things differently, and they just need some extra support and help to help them refocus, be able to manage their sensory differences. So when it comes to SPD, therapy is a great starting point. Working with an occupational therapist who can help identify what are your child's sensory needs. But there's more to it than just this, because our kids, they can go to occupational therapy, they can get that support in that clinical setting. But what happens when your child leaves the clinical setting, they come home, they're going to be in their natural environment. And we need to make sure that you as a parent know what you need to do to support their sensory needs. And so having someone, a specialist like a parent coach who understands sensory processing disorders, who understands how to support sensory needs, can give you the right guidance on what you need to do from an environmental standpoint to support your child if they're a sensory seeker, knowing how to incorporate sensory diets into your child's environment. If they are over-responsive and they're very sensitive to tactile or food textures, what can you do to help support them so that they're not just going to continuously avoid and you're going to have to be the one to face that behavior and struggle with that every day? That guidance can really give you that perspective that you need, and also tangible tools that you can implement on a day-to-day basis. Now, I know this can feel very overwhelming when you have a child with SPD and you're hearing all of this information, and now you're worrying about, well, how is this going to impact their day-to-day life, and how am I supposed to even implement anything to support them? And I want to reassure you, you are not alone in this. There have been so many families who've come to me with this exact concern, and I'm here to give you that guidance. I'm here to support you on your journey. And remember, this is a journey. You are raising a child with differences, and it's a matter of educating yourself, understanding what it is that they need, and what are the different tools that are out there that are going to be conducive to your lifestyle. So if this is something that you're looking for support in, I offer one-on-one parent coaching to help dive deep into your specific family dynamic, what is going on, and understand what is your child's sensory needs and how to actually support them on a day-to-day basis so that you can see improvements in their emotional regulation and in their behaviors, and ultimately make your whole life easier. Because I know raising a child with SPD has many challenges, and it is a very stressful journey for parents. And so making this as easy for you and stress-free as possible is the ultimate thing that you can gift yourself, because your child is wired this way, and there's no magical spell that we can, change how they are wired. It's about learning how to accept them and making adjustments that are going to support them. So that's everything about SPD. I hope you found this video helpful. Please like and subscribe to my channel, and write any comments, questions that you have about SPD. I'm happy to answer them, and I will see you guys in the next one.